Hello, it's Dr. Elisha Van Dusen of New Hope Chiropractic. Low back pain can have many different causes, and one of those causes is facet joint syndrome. And the facet joint is the cause in about 45% of patients with chronic low back pain. They actually have facet syndrome, and the facets actually generate the low back pain. There are many conditions that can give rise to facet syndrome. Some of these include straining your joint capsule, joint hypomobility, that's reduced motion in a joint, a synovial cyst, it's kind of like a ganglion cyst in the back of the wrist, but it's located inside your joint, and degeneration, also called osteoarthritis, and basically the joint wears out. And this type of arthritis, because facet syndrome can be part of other conditions or come with other conditions, a chiropractor evaluates each patient separately, and then obviously manages and treats each person appropriately depending on his or her case. So in pure facet syndrome, pain rarely ever passes the level of the knee and doesn't cause neurological problems or loss or weakness, loss of reflexes and things like that. You can have numbness, but usually not beyond your knees. Pain is usually not worsened by hip movements, like a straight leg raise or hip rotation. The facet joint's job is, at least in part, to limit or guard your twisting movements in the upper area of the low back and the back region, so it prevents over twisting. In the lower lumbar facets, that's further down, they're shaped to limit motion when bending backwards and forwards. So facet joints are special, they're unique because they're supplied by specific nerves that can be blocked by actually injecting an anesthetic agent, and that can block the main source of the pain. The surrounding capsule around the joint also contains mechanoreceptors. Now these are cells that measure and detect movement, and then nociceptors, those are cells that detect pain and fire when the joint is compressed or jammed together or overstretched, like with trauma. So these cells can become hypersensitized, they're very irritable, in other words, and that's when they're inflamed for a really, really long period of time. So in a lot of people, injury to a facet joint as a result of a lot of micro traumas over a long time, not just some isolated event or injury. Like, for example, constantly bending backwards over and over again, twisting, leaning to one side. All these things can overstretch the joint, fatigue it, tire it out, damage it, and decrease the function of the joint capsule. And then that becomes the sharp pain that leads to low back pain. So these joints become arthritic with age too, which is one reason people over 50 to 60 years old usually have facet syndrome. And osteoarthritis results then in narrowing of the joint space, and that causes more permanently a jammed up joint. And this is one reason a lot of older people walk bent over, because bending forwards actually opens these facet joints between the vertebrae and makes them feel better. Good news is that chiropractic care, chiropractic adjustments are a very highly effective treatment for facet syndrome and can help it a lot. And a lot of patients feel much better within even the first or second week of chiropractic adjustments, often within 3 to 5 visits. So if you have facet syndrome or you know somebody who's got it, it'd be worth your while to try chiropractic. Visit us at newhopechiropractic.com to make an appointment, and we'll be happy to help you out. Have a healthy day.